Good afternoon. My name is Iman Williams, and I'm the Health Education Program Manager for the Louisiana Department of Health Bureau of Community Partnerships and Health Equity. Today, we are hosting the second masterclass of our Health Equity in Action series to increase understanding about health equity and equip people with tools for improving conditions where they work, live, learn, worship, and age. This series consists of masterclasses, webinars, and in-person events. We aim to educate and inspire action towards bridging the gaps created by health inequities. These events are open to healthcare providers, community health workers, public health and social service practitioners, and community health members. Now, I would like to introduce our moderator, Hope Hickerson. Hope Hickerson is Executive Director of Healthy BR, Mayor Sharon Broom's Healthy City Initiative. With nearly 2 decades in the public health sector, Ms. Hickerson's career spans roles in university health centers, healthcare organizations, and public health initiatives. Holding a bachelor's degree in community health education and a master's in health education and promotion from East Carolina University, Ms. Hickerson's expertise is further broadened with a master's in counselor education from Louisiana State University, where she is also pursuing her PhD in media and public affairs. Hope was raised in North Carolina and ultimately came to Baton Rouge, where she started her family, met her husband, and had 2 kids. According to Mayor Sharon Broom, Hope Hickerson's experience combined with her passion for public health and commitment to our community makes her the ideal leader for Healthy BR. The core mission of Healthy BR is to create a movement grounded in communication, coordination, and collaboration, all in the pursuit of promoting a healthier life for everyone in Baton Rouge. Hope, thank you for moderating for us today. I will turn it over to you.
Thank you. I look forward to moderating this discussion. So the topic for this quarter is evaluating social determinants of health, data, and executing activities to address social determinants of health in your work. So today I will be conversing with Natalie Kilbert, Supervisor of Literacy Strategy at Louisiana Department of Education, Robin Goldblum, Library and Head of Adult Learning and Education at New Orleans Public Library, and Dr. Kurt St. Amant, Director of the Center for Health and Medical Communication at Louisiana Tech University. So the goal of this conversation today is to discuss the state of childhood literacy in Louisiana, how low health and digital health literacy skills impacted people during and after the COVID-19 pandemic, and resources for improving literacy skills in Louisiana. So first, I'll introduce Natalie Kilbert. Natalie Kilbert is currently employed with the Louisiana Department of Education as a Supervisor of Literacy Strategy. Previously, Natalie served as Middle and High School Literacy Professional Development Specialist, a Master Teacher Instructional Coach for grades K through 9 in all content areas, as well as a Content Leader Fellow, and Teacher Leader Advisor in the School of Social Studies. She also taught middle school English, Language Arts, and Social Studies, as well as wrote curriculum for 8th grade Social Studies. In 2016, she was a state semifinalist for Teacher of the Year for the state of Louisiana. Natalie earned a Master of Arts in Teaching from the University of New Orleans. Her work in curriculum and instruction, as well as working across content areas, has guided her work at the department and driven her passion for helping students become and remain successful readers. Next, I'll introduce Robin Goldblum. Robin Goldblum, Department Head of Adult Learning and Education at the New Orleans Public Library, holds a Master's in Public Library Science from Louisiana State University. She has worked in her profession for 15 years and has extensive expertise in the areas of adult literacy, health literacy, technology literacy instruction, community-wide programming, and readers advisory. Robin is dedicated to improving the lives of all people, especially working with adults. Her professional and personal objectives are to connect people with information they need to grow and thrive. Robin is passionate about bringing issues of diversity in lifestyle and literacy to the community, which is a vital component of the library's mission. She initiates and implements partnerships and programs with organizations aligned with the library's mission and strategic plan. Robin is the mother of a University of New Orleans senior and a freshman, and is married to a computer scientist who also loves to program. She's a native New Orleans and lives in Algiers Point, located across the Mississippi River from downtown New Orleans, where she loves to walk on the levees. Finally, I'll introduce Dr. Kurt St. Amant. Dr. Kurt St. Amant is a professor at Eunice C. Williamson Endowed Chair in Technical Communication at Louisiana Tech University, where he serves as the director of Louisiana Tech University's Center for Health and Medical Communication. His research focuses on the psychological processes affecting communication in healthcare and medical settings. So before we begin our conversation, we need to define some key terms. Because we'll be discussing social determinants of health, I'm going to define this term. Afterwards, I'm going to ask each of you to define additional terms. So the CDC defines social determinants of health as conditions in the environment where people are born, where they live, they learn, work, play, worship, and age that affects a wide range of health, functioning, and quality of life outcomes and risk. So Natalie, let's start with you. Could you define literacy?
Sure. So literacy is the ability to use printed and written information to function in society, to achieve one's goals, and to develop one's knowledge and potential. And this comes from the National Center for Educational Statistics. We also just like to say it's the ability to read, write, speak, and listen all play a part in someone's literacy.
Yes. Thank you, Natalie. Robin, could you define digital literacy for us?
Yes, hello. The American Library Association defines digital literacy as the ability to use information and communication technologies to find, evaluate, create, and communicate information, requiring both cognitive and technical skills. Digital literacy skills are needed to fully participate in economic, civic, work, and daily life. And what this looks like is digital literacy encompasses everything from reading on a tablet to gauging the validity of a website or creating and sharing YouTube videos.
Wonderful. Thank you, Robin. And Kurt, could you define the term personal health literacy? And also, could you define organizational health literacy and digital health literacy?
Sure. So personal health literacy, think of it in terms of, say, two U's, if you will, understanding and usability. Do patients understand the information that they find before them, and can they use that information to achieve a specific health-related objective? So it's comprehension and performance that the individual performs related to themselves. Organizational health literacy looks at those two U factors, if you will, across an overall group or organization, and it could involve one of two things. It could be communication within the organization itself, a common understanding of how to convey information to other individuals within an organization, or a common standard that individuals in the organization use to share information with others outside of it. So there's a consistent foundation of how to convey ideas that the recipients of that information can understand and then use. And finally, digital health literacy looks at those factors and how they're delivered. Can individuals not only understand information and use it as needed to achieve a healthcare objective, do they also understand how to use the technologies that are being used to convey that information, to access it, or to share information with others?
Thank you, Kurt. Thank you. So let's talk about childhood literacy. Natalie, according to a Louisiana Department of Education report, early literacy is a predictor of educational and lifelong success. So what is the state of childhood literacy in Louisiana?
To determine the state of literacy in Louisiana, we first look to NAEP, which stands for National Assessment of Educational Progress, or as is referred to, the nation's report card. And so it is the largest nationally representative and continuing assessment of what America's students know and can do in various subject areas. While the national scale score averaged a decline 3 scale points on both 4th and 8th grade reading assessment from 2019 to 2022, Louisiana led the nation in growth by increasing by 2 points on the 4th grade reading assessment. This growth led to the increase in national rankings as well. Louisiana now ranks 36th in fourth grade reading and 40th in eighth grade reading. We were previously 44th and 48th, so we saw some good growth there. Another measure is our ELA mastery rates according to the LEAP standardized state test, in which we saw our first gains in third grade reading since 2017 and 2018, where we grew by 5 points. And lastly, our kindergarten through third graders are measured by our single universal literacy screener known as Dibble's 8th, which screens for any needs in foundational reading. Our fall 2023 report results reveal that our kindergarten students need a lot of support, but first through third grade are on par with the rest of the country with plans to continue support for future growth.
Okay, love improvement. Great. Thank you. So moving on to health literacy, and digital health literacy skills in COVID. So Kirk, Healthy People 2030 identifies health literacy as a social determinant of health. So according to a National Institutes of Health article, people with low health literacy skills were more likely to have difficulty with information about COVID-19 than other individuals. So when we think about people with low health literacy skills, could you explain what types of challenges they experience when provided with information about COVID-19?
I think it's a multi-part question, but the biggest thing comes down to trust. Nothing is used unless the people receiving it trust the source of information. And in many cases, that trust is based upon, are you speaking at me in a way I understand, recognize as credible, and cite background or sources that I believe in or find reliable? And as we saw with COVID-19, the speed with which different kinds of information were proliferating, the sources they were coming from, and in many cases, the fact that they seem to contradict each other, and in also many cases, written at different levels from the individual who happened to use them, all of these things create confusion. And when you're seeking out information in that environment and determining how will I apply my literacy, my understanding, and take the time to read something, that was the marker that needed to be met. So if you will, it's the first step through the door. The only way to make health literacy effective is for individuals to believe it applies to them, consider it credible, and then be willing to pick it up, process it, and act upon it. And I think that's one of the lessons to learn of what came out of COVID-19.
Right. So why were people with low literacy skills more susceptible to that misinformation and disinformation during the pandemic?
I think in many cases it came down to two things. And the first was trust in terms of the information being provided to me is not the level I expect it at, does not speak in my own terms, does not recognize my situation. And as a result, number one, this probably isn't for me, since this isn't how myself and the people I trust and rely on interact. And number two, something must be wrong here because I don't understand what's happening. Or better spoken, these directions, instructions, and this information doesn't apply to my lived experience. The context I find myself in, this information does not describe. And so as a result, there is again that breakdown. And it's a matter of building that kind of trust by understanding what are the expectations individuals have that they associate with trust, and where are they when they're trying to act on this information so they can look around them and say, yes, this applies to me. I can perform this process where I am right now.
Definitely makes sense. Yes. Thank you for that. So Robin, the COVID-19 pandemic, the subsequent nationwide lockdown, and the need for social distancing resulted in a surge in usage of digital health tools like health websites and health apps. So the aforementioned tools can play a pivotal role in facilitating healthcare, health information delivery and storage, and health-related social support. So as we observed during the pandemic, digital health tools provided little value if the patients and the health professionals lack skill to use them. So why is it so important for people to have and possess basic digital literacy skills?
Great question. It's important for people to possess basic digital literacy skills and what we learned from the onset of the pandemic so they can navigate away from misinformation, inform their well-being and health, and involvement in community. Digital literacy skills help us to navigate in the world. Accessing technology is second nature to those who are tech educated and privileged enough to possess a phone, a tablet, internet, tools and digital literacy skill. I mean, all of that, and a computer. Some people's basic digital literacy skills consist of using their telephone. Many people can read an email, but do not know how to respond to or write an email. It is dangerous if you do not possess digital skills to help you interpret online information critically as well.
So what do those basic digital literacy skills consist of?
Right. This is a little bit bigger
Mhm.
than what I just said. Knowing how to find, navigate, and understand information, foundational computer skills, smartphone use, communication for learners so they can engage and express with and in technology, critical thinking, which means possessing the skills, knowledge, and ability necessary to analyze and process online information in order to draw educated and informed conclusions, how to seek out what works and doesn't, and finally, developing strategies for self-advocacy, which includes social skills and empathy and self-awareness. This will assist in deeper learning and teaching.
That's great, Robin. Thank you. So moving on to digital literacy versus digital health literacy. So Kirk, how does digital literacy differ from digital health literacy or e-health literacy?
I think it has to do with the objective you're trying to achieve and what you consider success. There could be multiple ways of using an app to achieve an objective, like make a phone call. But in the case of your health, there's one specific way you want the patient to upload their, say, blood pressure information so it can be used within a database system. What is that one specific way? What way will doctors use to communicate with patients through a Zoom call, let's say? What are the expectations there? So it's realizing that while we have a broad range of expectations for how to use technology to interact, to access, and share information, we require a much more narrow and common set of parameters to use that same technology to effectively exchange information about health in ways that people can understand and act upon or use effectively.
Wonderful. Thank you. What about factors? What factors influence people's digital health literacy skills?
Three factors, if you will, and they're kind of strange things. Familiarity with the technology. Just because I have an iPhone and can use it to make phone calls and check email doesn't mean I know how to download an app with it. That's a different skill set. Do we know that the person using that technology has that skill set? Use of medium and expectation of user. If I'm using online material to perform a process on myself, do I want to be reading it off of a web page or watching an instructional video that talks me through how to do it? And if an instructional video, do I have the option to pause it so that I can check what I'm doing before I move forward? Is that built into the system, or do I need to know that in advance? And finally, things like screen size. If I'm going to perform a process effectively, understand something effectively, can I see what I need to see in the digital space I have in front of me? If you've built something for a laptop computer and I've got to use it to, say, check my insulin levels from a mobile phone screen, there could be confusion there simply because of that compatibility.
Yeah, that makes perfect sense. Okay, thank you. Thank you. So thinking about childhood literacy and the connection with health literacy, Natalie, according to the Centers for Disease Control and Prevention, developing personal health literacy skills should start in early childhood years. What is the correlation between early childhood literacy and health literacy?
So there's a direct correlation between early childhood literacy and health literacy, and preparing children for early literacy skills allows them to be active participants in their own health journeys from a very early age, and their capacity to learn and grow through their health journeys grows as they progress in age and in their literacy journeys. Promoting health literacy in early childhood programs increases the likelihood that children are healthy and ready to learn. And by focusing on health literate practices, early childhood programs can also improve communication, reduce health disparities, and advance health equity for all program participants. We look to the National Center on Health and Behavioral Health and Safety for that information. But reading is one of the most important skills a child can learn. It allows them to gain knowledge and understanding about the world around them, as well as develop critical thinking and problem solving skills. By the time a child is able to read, they have already learned many important literacy skills, such as decoding words, making sense of the text, identifying letters and phonics. And reading allows children to explore new worlds and different cultures. Within the last 3 years, literacy has become a major priority at the Department of Education from birth through 12th grade, and bringing awareness to the importance of literacy. In regards to literacy, the biggest piece for early childhood is oral language and the impact it has on overall literacy. Knowledge around how children best learn to read has also become a priority grounded in research and the science of reading. And there also have been 2 literacy advisory commissions that look at the current state of literacy in Louisiana and make recommendations to BESI, legislators, as well as the LDOE. All of these things will indirectly impact a child's health literacy.
Wonderful. Thank you. Thank you, Natalie. So on to one of the most important pieces, resources, right? How can folks find out about these services? So Natalie, you discussed the Louisiana Department of Education's initiative to improve childhood literacy across the state. So has the Department of Education created childhood literacy resources for educators and parents? And if so, how do people access them?
Absolutely. So tons has been put into our Louisiana Literacy Library. You can access it by just Googling Louisiana Literacy, but we're also going to provide the URL to you. But there are 4 different pillars on the Louisiana Library. The first 3 pillars are for educators, leaders in education, but the 4th pillar says families. And those are resources specifically for families to access to help their children at home.
Good, good.
Thanks.
So are the childhood literacy resources for parents available in different languages? And if so, what are those languages?
Absolutely. So they're available in, of course, English, Arabic, French, Spanish, traditional Chinese, simplified Chinese, and Vietnamese as well.
Oh, wonderful. Good, good. Thank you for that, Natalie. Robin, what resources are available to assist the New Orleans Public Library's patrons, including adult learners, with improving their digital literacy skills?
First of all, the Adult Learning and Education Department uses a book a librarian platform, which gives us the opportunity to learn both what library patrons are looking for and their needs, and how we can support them best by connecting them with learning environments, including high-set instruction, vocation and apprenticeship programs, skills building, resources, and more. Phone numbers for the Book a Librarian are all over our website so that people who are not yet tech savvy, can access us easily. And you can also access this platform on our website. We have zillions of great resources on our website, and we live and breathe them. North Star Online Learning is one. It was developed in response to the needs of job seekers who may lack digital literacy skills. Digital Learn is an online hub for personal and workplace success skills. And I will say in advance, I think that all of these are available in definitely Spanish, some Vietnamese, and probably likely more languages. We have language programs as well as a resource for the non-English speakers. The GCFglobal.org is a great program, as well as Homework Louisiana, which provides live tutors online. And this is not only for students, young students, it's for adults as well who are looking for career and digital skills support and help. And you can access a real live person on the other end of that. That is, if you are able to access this. Also, the library partners with the YMCA Yes program, who is housed inside the main library, and they provide free practice, instruction, and support for adults in reading, writing, math, ESL, computer skills, workplace literacy, and preparing for HEIA. So we cover a lot, and as important as any of our resources, being able to communicate with people in person, whether on the phone or in person, is very important to our department in particular, because we're there for those who are looking and have made that bold move to really, up their skills. So happy to be here to do that.
Good, good. Are there any specific criteria for accessing those resources?
Well, you must have access to Wi-Fi, a phone, a tablet, a laptop, or library PCs. Some of these resources are free and open to all, and the library resources can be accessed for free with your library card. So the library card is the bottom line.
Right, right, good, thank you. So Kurt, what resources are available via Louisiana Tech University's Center for Health and Medical Communication to assist organizations with improving their digital and print content? And how do organizations access those resources?
We provide a number of different services for organizations and individuals in Louisiana. We do things like a literacy assessment. What is the health literacy level like in certain areas or with certain groups? We do also what we call usability assessment. We take materials designed for different groups and determine how effectively those groups can actually understand that content and use that information to perform a particular process effectively and successfully. We also do what we call a media audit, trying to figure out what are the best kinds of media to use to share information effectively with different communities according to their health literacy as well as their digital literacy backgrounds. And then we do assessments of these kinds of things to help organizations determine, have they selected the best medium to use? Do they want to consider using it slightly differently or change medium for doing things? In addition to that, we do provide training to other individuals and groups in how to do these things as well. We tend to do this on a case-by-case, or if you will, client-by-client basis. And so what I encourage individuals to do is to contact me or contact the center through me at my email address, which is stamantk@latech.edu, and to request a time when we can meet and chat. And by discussing the objectives, the project, and the community with that client or with that individual, we can best determine what kind of work we can do together to help them achieve a certain objective.
Thank you, thank you. So you guys have been doing this work, so let's talk about some lessons learned. Natalie, what lessons have you learned from your role in improving the childhood literacy skills of students in Louisiana?
So one of the main ones is the importance of continuing to build awareness of literacy rates and resources as new information becomes available. Funding has also been a huge thing to jumpstart the initiatives that I spoke about earlier and to keep them rolling. We've had 2 large federal grants, which are about to run up, so seeking future funding for those. Professional development is key for our teachers and leaders to continue to grow literacy outcomes for our students. Families play an essential role in their children's literacy development at all ages and stages. Our data is showing improvement, but it's not an overnight initiative. And that being said, the data is moving in the right direction, but we have some work to do still. And then lastly, just informing all of our stakeholders, educators, families, policymakers is critical to ongoing success for literacy in our state.
Great. Robin, what lessons have you learned about adult literacy and digital literacy as a result of your position in a New Orleans Public Library?
I streamlined on this. Listen to people's stories. They have big lives, and we have so much to learn from one another. That those who have not had the privilege and opportunity to access literacy skills, but are able to ask for support, are performing big actions that need to be met with respect. No one should lack broadband. And our enormous justice-involved community are entitled to skills building support, including digital skills.
Thank you. And Kurt, what lessons have you learned about health and digital health literacy from your role at Louisiana Tech University?
That effective literacy is often about time and place. It's not so much do people understand information, can they use it based upon where they are and when they're trying to accomplish something? And that drives a lot of attention. I can focus attention one way if it's first thing in the morning, I'm sitting at my kitchen table and nothing is going on around me. You have my total attention, I can focus, and you can provide me with large pieces of information at one time. If I'm trying to achieve the same task at the end of the day after picking up my small children from school, while preparing dinner for my family, while watching children, all of those factors affect my attention, what I can focus on, what I can comprehend, and what I'm able to do in that context. And so the better we understand when and where people are trying to use health information, the better we can address literacy in terms of usability by understanding those factors of time and place that affect attention and comprehension processing.
That makes perfect sense. Thank you. Yes. So we're wrapping things up. So before we do that, I would like to ask each of you one last question. So Natalie, what do you think about the future of childhood literacy in Louisiana? When you think about it, what are you hopeful about?
Well, I'm really hopeful for more people involved in conversations just like this. Besides just our educators, it really takes a village to grow and develop the children of Louisiana. So these kinds of conversations are essential. I'm hopeful to continue to have an awareness for all of our stakeholders. Literacy is a priority in grades K through 3 now. Um, but we really need it to be a priority in early childhood as well as our later grades as well. And then lastly, I'm hopeful about our overall impact through our resources that we've developed. I spoke about the literacy library a little while ago. They have been used by not only educators in Louisiana, but we've gotten requests all over the country to use the resources, California, Missouri. And so just continuing to build the wealth of resources that we have grounded in research.
That's great. That's wonderful. Robin, when it comes to literacy and digital literacy in Louisiana and the future of it, what are you hopeful about?
This is my big answer. I'm hopeful that in-person digital skills building programming, as well as virtual programming, finds its way into all public libraries. The goal is to reach everyone, that our jails and prisons will take serious action to provide digital skills building classes and programs to those justice involved inside and outside of incarceration, that public transit is increased, houselessness decreased, and other wraparound services strengthened, that the state of Louisiana will create a digital needs support system infrastructure of digital needs support systems, so we will be able to identify the level of need and have the funding and civic support to lift our state up. And that communities get creative in reaching folks who have barriers preventing them from coming into or making contact with the library, whether these barriers are poverty, having experienced racism, language issues, lack of access to affordable broadband, inflexible jobs, family care, emotional barriers, putting our heads together. Any village, as Natalie says, can create a support strategy to knock down barriers. And finally, that everyone is coming to library programs.
It's true what they say, it takes a village, right?
It really does.
Yeah. And Kirk, lastly, when you think about the future of health and digital health literacy in Louisiana, what are you hopeful for?
I'm hopeful for the same sort of village community metaphor that we've heard about already before from Natalie and Robin. I'm hopeful that we've learned through the pandemic that we don't have to be islands of healthcare anymore. We feel more comfortable reaching out and collaborating like we are right now, because no one of us has the answer. And we've seen a renewed faith in community. Not only do we need to be part of our community and engaged, and it's treating health as a community issue and a community responsibility. And that in collaboration together, I think really stitches together the perfect context that will help us moving forward address all these other literacy challenges by working together to solve them.
Working together, that's
Yes.
the point, right? Working together. I would like to thank Natalie Kilbert, Robin Goldblum, and Dr. Kurt Sandomal for participating in this very insightful and informative conversation. So this concludes our masterclass discussion. Please stay tuned because we will share the link to the recording and the schedule for upcoming health equity and action events with our partners shortly.